some people might know what ROI means, okay? But before I tell you what it means, this is what you are every time you walk into a hospital. That's what you are to the administrative department. Now, there was a time, as I've said before, the administrative department, the CFOs, CEOs, with their leaders right below them that are injecting themselves practically to the bedside now. That it used to be somewhat separate so that care could still be respected. But because the CFOs, CEOs, and their little minions in the administrative departments have injected themselves with the help of chief nursing officers into the hospital units and are dictating down to almost the patient care at the bedside, that's when it's gone rogue and it's off the rails, and it's why I call these people psychopaths. Now, many people, anybody who ever watches some of my videos where I call these people psychopaths, you would say that's a bit of an exaggeration. No, it's not. It's really not, and here's why. When the administrative department injects itself so much into the patient care area to where they're dictating when you have to take somebody, yet they won't give you enough staff. They'll still keep admitting even though your unit is unsafe. And yet they expect you to manage something that you cannot manage, and they won't give you any respect to listen to you. So one of the things, to give an example of this, is I said recently how they want people that are in intake, patients, they want them brought back in 90 minutes. That's fine. But there's certain times of the day when, like I've said, during MedPass, you should not do that to nurses because it's not safe. Now, people love to make the argument, no matter what hospital it is, no, this person's been down here forever. Well, then they have to wait. That you don't sacrifice safety to accommodate a time frame. You just don't. And I'm talking, realistically. So if there's a problem, they don't give you enough staff, so you have a crisis going on in the unit, and then they say, no, we want them brought back, we're sending them, the CEOs, the CFOs have told us we have to. Then that's endangering all the patients on the unit, especially if you're in the middle of a crisis. That's endangering the staff. It's endangering everyone except the administrative department. So you really have to have you have to have a mindset that disregards care for everyone, and they do. And I'm going to explain. The reason I'm bringing this up is because I'm going to just read some of the things that CFOs have said recently. They really think that they're on the track of success. Look, they will never have a long-term success here. They won't, because the more that they have injected themselves, the administrative department has injected itself all through the care system, the more care has been destroyed. And what they love, okay, and this is why they love all their cameras everywhere, because they love to see staff fighting with each other. And this is what happens, and I see this happen a lot. Staff want to blame other staff members when really, I will often say, we're not the problem. The problem is the top. Please understand that. They're being disrespectful. They know they shouldn't do these things, and they do it anyway. So instead of attacking each other and saying this is your fault, no, when they leave you so little staff that safety ends up being compromised when trying to do a physical hold or needing to give an emergency injection, that is because the administrative department has injected itself onto the unit, where doctors and nurses know how to run their units. But because they get those minions like chief nursing officers and others that decide everything, that's the reason it's being destroyed. So they can't even understand what I'm saying, because they don't have empathy. You literally would have to have no empathy to do what they do, to disregard safety, disregard patient safety, disregard staff safety. And that's what they do. Really, just almost everywhere they do that. And what's happening is, so rest assured in this, they are going to fail miserably, because it's this rubber band that's being pulled and pulled and pulled and pulled and pulled by them. And it's going to have this smack back, and when it smacks them back, it's going to throw all of their asses in handcuffs, smack them around a little bit. No, maybe not smack them around a little bit, although that would be, nice to see, but not necessary. But handcuffs for sure. And the reason I say that is that if administrators, CFOs, and CEOs want to inject themselves into areas they have no business injecting themselves into, and they're no longer working like as a collaboratively with the care units. Instead, they're getting their minion chief nursing officers to go along with their twisted agendas and then try to convince the staff, and everybody knows it's not right. Then that they're literally, they have no empathy. You can't restore that. They never had it to begin with. And here's an example. R.O.I, and this is what every patient is when you walk into a hospital, is you are a return on investment. This is why the administrative departments of the hospitals running everything is disgusting, because it's all about money. Patients are seeing that more and more. They know that, especially in behavioral health, most think, I don't even get anything out of this. What's the point? And they'll try to clean their act up a little bit here and there, but what they do then is they stress the workers out more. The reason this will never be successful for them is because you can't have psychopaths running healthcare and expect it to be successful. They disregard care because they think it doesn't matter, but it does, and that backlash on them will be a harsh one. By the way, I wanted to mention I've thought about this for a good year. I'm like, what, in the past 2 decades, 3 decades maybe, but definitely 2, what has the higher education really done for people? Like, what have they really walked away with? And I realized today what it was. The higher educated taught those people how to be good bullshitters. And I've read it for years in the American Nurses Association's expert papers, American Medical Association expert papers, Endocrine Society, take your pick, they're all the same. They're all higher educated, and so they can take something that's stupid like diversity, equity, and inclusion, gender affirming care on youth, and they can make it sound all, like it means something because they use their higher education words and sentence structure in ways where it sounds like, well, even though I don't clearly understand, like to the layman, it would be like, well, I don't really understand what that means, but they would know. It sounds good, so I'll trust them. They're just good bullshitters. So these I'm bringing up our ROIs because CFOs have made some statements recently. I mean, they usually do, but nobody really pays attention. So they're so excited and they're just saying all the same bullshit they always have. But AI is like, their baby. So one of the things they said regarding ROIs, and that's what you are to them. And this is, again, from chief financial officers in healthcare. As an example, there's no reason why we shouldn't be using AI to do prior auths. Today, we have a team of about 80 to 100 people across the system doing this. We still need those 80 to 100 people, but we should focus them on other higher parts of the business as opposed to following up on prior authorizations. They will just get rid of those 80 to 100 people. Look at what they've already done. Everything's been about scaling back on care. So they're just good bullshitters. Growth initiatives should have targeted ROI, whether financial or mission-based, and where possible, should align pricing strategies in payer relationships. This coming from Yale New Haven, Connecticut Health CFO. Consider optimizing systems of care, including partnering where it makes sense. Systems need to ensure that patients' needs are at the forefront. They're not going, so they can say this. This is my point. They say this all the time. Psychopaths will say whatever they have to. But those same psychopaths have injected themselves all the way to the bedside now. They don't have any understanding of the way a hospital floor works. They have no medical background. But they're such arrogant people that they have decided to risk patient safety and patient staff, all to serve their pockets. I'm going to follow this up with another video so people can hear exactly what chief financial officers of healthcare, different healthcare systems, really think of care.